Hi, everyone. Welcome back to our podcast where we explore the latest trends and technologies shaping the future of business and healthcare. So today we have two amazing guests.
That's right, Ned. We have Bruce and Sheila with us today. Bruce has a background as a CTO, AI strategy, tech ops, blockchain, data ethics, and Web3. So we're going to be exploring some of those topics with him. And Sheila, she has a healthcare and innovation background and also a superpower of business operations and creating efficiencies around that. So we're really thrilled to have them both here today.
Absolutely. And before we dive into the conversation, let's set the context for our listeners, actually, that what is the term Web3 and what are we referring and talking about today? Web3 is the term that we use to describe the next generation of the internet, where decentralization and transparency and the sense of ownership are the key principles of what we are talking about here. Technologies such as blockchain, DAOs, which are the Decentralized Autonomous Organizations, and also the DApps, which are decentralized apps. And no worries, these are so much technical terms, but we are here to just go through them one by one. Web3 has the potential to just transform various industries, including business and healthcare.
Yeah, it's great, Ned, that you mentioned that we're going to sort of talk about some of those technology terms and new terms to some of our audience as we go through it. As we mentioned, we've got some amazing guests. Bruce and Sheila, would you guys like to introduce yourselves to our audience, please? Bruce, do you want to start?
Sure. Hi there. So I'm Bruce Hoffman, and I'm the CTO of Evenness. And, I've really been passionate about using technology to create a more inclusive world. And really, that's the reason that I joined Evenness. The promise of InnoCityX, an immersive and inclusive metaverse, and the opportunity to help build it really continues to intrigue and inspire me. I've got over 20 years of experience in the tech industry. I've worked as a senior technology and product management professional. I've led product and technology teams and delivered many different products and multi-million-dollar data products in many sectors. Before joining Evenness, I've held positions at the Motley Fool, Fox Studios, Metadog, Cox Automotive, and Kelley Blue Book. And I've got skills in AI, machine learning, information systems, data analysis, valuation systems. And I really, my goal is to define and execute strategic roadmaps for new business capabilities. Outside of work, I love to ski, hike, kayak, walk my dogs, just be outdoors. And it really recharges and inspires me and reminds me of the importance of sustainability and taking care of our planet. And I'm really excited to be here today and share my knowledge and experiences with all of you in the metaverse. And thank you for having me.
Wow, Bruce, I'm not sure where you have the time to do all of that, but wonderful to hear all of those things.
I don't know either.
Sheila, can I hand over the mic to you? Thanks.
So my name is Sheila Phicil. I am so thrilled to be part of this podcast and have the conversation with you all. I feel like I have to read off a couple of disclaimers. One, I don't have as impressive a history as Bruce in the Web3 space. I still consider myself a relative newbie. And this is actually even my first time engaging with spatial, although I tried to dabble in it a couple times with my VR headset and it wasn't successful. So I'm really thrilled that my avatar is working and it's sitting down. Hopefully it'll stay sitting down. So my background is as a healthcare administrator. My day job is as director of innovation as part of a health equity accelerator at a major hospital system in Boston, Massachusetts, Boston Medical Center. My job consists of a variety of things, but I really see myself as bringing a couple of key skills. I think of myself as an equity architect. I like to bring that lens of, who is missing and how can we engage them and how can we ensure that the things that we are doing aren't creating unintended harm and instead are elevating all people. So I definitely bring that into the work that I'm doing. And operations is really where I have a depth of experience as a project management professional, as someone who's done large-scale projects in the healthcare space, including launching, electronic medical record systems, implementing entire workflows around how we admit and move patients around the hospital, troubleshooting major issues that arose around COVID, which was a huge eye-opening and awakening moment in healthcare as we kind of finally fully put ourselves into using the tools at our disposal, including telemedicine and other things. In my current role, I also do a lot of work around systems innovation, which is looking at the broad perspective of how we move and how power moves amongst patients and providers in our community, and designing like engagements and workflows that balance that and keep people engaged, and helps us to accelerate the changes that we're trying to make in healthcare. So outside of my day job, I'm a bit of a nerd. I spend a lot of time actually in my VR goggles. I work out in them. I meditate in them. I also have been part of the some communities, including NP, which is how I met Bruce, and love to learn more about the Web3 space and share what I've learned with others as well. So I'm really thrilled to be here.
Nice. So it's great to have you both here. And it's also my honor to be here next to all of you amazing people. So let's start with some questions about Web3 and its potential impact. Bruce, let's start with you. And I want to know that as someone who has a background in AI strategy and blockchain, and like being a fractional CTO, which I love you to explain a little bit about that term as well. Like, how do you see Web3 technology such as blockchain, DAOs, like, as I mentioned, Decentralized Autonomous Organizations, and the DApps, which are the Decentralized Applications, shaping the future of business and startups?
Wow. Well, that's actually it's a very loaded question, but I'll try to give you my summary around it. So, I mean, Web3 tech, let's start just for a moment and say it's a new wave of technology that's going incredibly fast, but that doesn't really tell you anything about, what the change is. The big change is really kind of moving from the big corporations to smaller organizations initially that could be started by anyone. The blockchain itself is really something that allows us to create transparency and security. And we should think about the blockchain, really, it's a set of cryptographic keys that then people don't really think about what it is, but behind the scenes, and this has been used in banking and medical for years, of having private blockchains to secure data. What came in our space was a much more public blockchain that allows you to see all of the transactions as they're occurring. And so you've got to think about how you store data. DAOs themselves are very interesting because it's the new way of doing business. It's a challenge. I've seen lots of DAOs out there, and most of them not being successful because new young people are coming in and haven't run businesses before. But really, it's giving the opportunity that everybody who is in has a voice. Everybody has the opportunity to have ownership. It's basically thinking of it as a series of employee-owned companies. That is the model, and it's finding good leaders that we can trust. And really, decentralized apps really just means that it's an application that's being used on the blockchain, and often instead of storing and having the data all in one place, it's being stored also in a decentralized fashion across. And they call it sharding, across multiple servers. So I think that's sort of a good start on this, and we can delve further in as you have more points you want me to go deeper on.
I love hearing everybody's different descriptions when they talk about Web3, and it just like starts to open more layers in terms, at least from my understanding as well. And I love that comment about voice and ownership and bringing that in as part of Web3 and the DAOs that are being created. Sheila, with your background in healthcare, how do you envisage Web3 technologies impacting the future of healthcare, and in particular patient empowerment?
Yes, as I make sure my avatar keeps sitting. I think the idea of ownership is one that's really important. In our earlier conversations, I talked about how I feel like in healthcare, we're just now really maximizing Web2 tools. It's only in the past, like maybe 10 years that electronic medical records and being able to access and make appointments online, being able to talk to your provider, via video, those are things that we're really just now fully capitalizing on. And Web3 obviously has the potential to revolutionize healthcare from an ownership perspective, in the sense that patients could really have more access and control over their health data, and being able to transport and share that data with different healthcare providers. It's very common that you might see patients that are getting care across multiple systems, or even within systems within multiple sites. So having that data being portable is really important. And I think that the space that this has a lot of opportunity is in the research. Research is all about collecting data so that you can find new treatments and therapeutics and opportunities. So being able to engage patients in a way that they're not just being participants in the research, but they can own the data, make informed decisions about their health, understand how their data contributes to how the healthcare evolves, I think is a huge possibility for sure.
No, I was just going to make a comment, and to what Sheila said about Web3 and healthcare. I really do think it's that opportunity for you to own your own data, which is really also, it's a Web3 thought. It's like, I want to own my own data. I don't want to just give it out anymore for free, and that, I think that is one of the keys to innovation in healthcare and there's been a number of different DAOs that have started up, are focusing specifically on, owning my own data, but then also having the opportunity to monetize my own data if I want to. So it's an interesting concept, saying, hey, now, okay, my health data might be very interesting. I'm willing to give it to the world, but I actually, would like to be remunerated for it.
Yeah, I like that. It's a very promising vision that like you are giving about the future of healthcare, Sheila. Like, I love it. As we continue this conversation, I just want to see that as Web3 continues to evolve, what advice do you have for, the audience, for people who are listening to us today, to stay informed and, adapt themselves to this changing environment? Because one of the things that I find very hard for people nowadays is that, adapting to this new environment that is completely everywhere right now. Like, I cannot find a place that people are not talking about, for example, ChatGPT, or like wherever you enter, you hear at least one or two people talking about Web3. Though there are a lot of people right now who do not know what's the meaning of Web3 and what benefits it will bring to our lives. And on the other hand, what are the cons that we spoke about this actually in our previous podcast with Heena, that we as builders are those who have to care about the sustainability, especially that we are close to the Earth Day, and we really love to always talk about the innovations and sustainabilities. Like, how can we build a better world for ourselves, like as Bruce just mentioned earlier.
So what's interesting, I would say, in some ways, it's impossible to stay completely up to date, because as an individual, right, we have one brain, and there's millions of pieces, of information that are just flying at us. I think for a while we were in the information age. I like to call this more the instant age, because it's like anything is available at any time, just like you were saying, everywhere. Here we are on this session, we're all in different parts of the world, that may not be obvious, and we're all sitting here together, which is actually something that the metaverse or these spaces, allow us to feel like we're actually in a space together. Staying informed and keeping up to date, it's a constant challenge for me on a daily basis. It's part of it is really choosing, once you start to know about Web3, the areas of it that you want to know about, and focusing in there. There's literally thousands of NFT communities, a bunch of them that are actually working on sharing and learning. And of course, that's how Sheila and Ned and I met, was in one of them. And I think the idea is find some reputable people that you trust, follow them on LinkedIn, follow them on Twitter, see if you can find, a Discord where they are in. If not, talk to knowledgeable sources, like even like the people here in this room, to say, here's what I'm interested in, here's what I want to learn, and let me come in and focus on it, because there's just constant sources. I mean, you've got everywhere you look, there's a space where you can actually get more learning. And I know that wasn't very specific, but it's very available. I think that's kind of the word I want to use, is the information is there and available. Choosing a path once you've got there is try to get yourself focused into a smaller number of areas. And I'll just add to that to saying, it's like, when I looked at this a year and a half ago, I thought of it as this technology wave. I was sitting down with a friend and we were just looking at this giant circle of blockchain being in the middle and all of these technologies sitting around it. And at the time, there was already about 1,000 companies that were represented on that circle. And that was a year and a half ago. I imagine that number has grown exponentially, but also shrunk at the same time, because there's so many startups that come into this place because it's easy just to go start something, try to do some sort of monetary raise or not, and then go with it. But again, try to look for, somebody that you feel like you can trust, or a group of people that you can trust, and find them in those different locations.
Sheila, you have some thoughts to add?
I think for me, what I'm always looking for is what's changing that impacts the way that I think about or interact with the Web3 space. And obviously, because things move so rapidly, it's hard to stay informed. What I find that works for me is I try to find thought leaders that I trust and people that I know are really leading the way in creating the future of Web3, and follow them. That just makes it easier for me, because the information is already vetted. They are part of making the future of Web3. I can follow along with the trends and what they're doing. And I think the other part is just really getting involved, finding a community that you feel good about and excited and invigorated to be part of, and volunteer, ask questions, offer yourself out there, and you really learn by doing. I think is really the best way.
The fact that you just mentioned, that staying involved and finding those who resonate with you, that's why I'm sitting here today with all of you people.
Yeah, totally. And I love the way you guys were talking about being really proactive about the information that you're going for and looking for, and thinking about the areas that you're really interested in and drilling down. So somebody might be interested in the blockchain side of things. Some people might be looking at the impact from an industry perspective, but it's looking at that vetted and validated and trusted information sources, because I think, Bruce, you sort of said there's a lot of information out there, and just sort of making sure that it is from the right sources. And talking of that sort of right sources, I think there's also some challenges and considerations that we need to think about when, people are looking at Web3, around sort of ethical considerations when adopting that. Can you perhaps tell us a little bit about that area, Bruce? I know you have a background in some of AI ethics and Web3 ethics.
It's interesting. I participated in an AI ethics hackathon. Actually, I was mentored a series of teams there. And what was interesting is, if we even just take this outside of Web3 for a moment, and we talk about ethics, we always were building things, especially in the data space where I've lived, to take advantage of what we can learn from the data, but without a specific focus on, whether it was ethical. We would say, is it legal? Which is kind of an interesting, thought around the whole space, was like, saying, well, is this legal? The legality of things never seems to catch up with maybe what's right to do. And so ethics puts on a different hat and says to you, am I thinking about how I'm approaching the situation? If I'm going to use someone's data, do I make it easy for them to understand when they chose to join this group what data I'm using? You see all of the new websites, or every website you go to that you haven't been to now popping up with like, hey, do you accept that I am tracking all this data about you? And what do most people do? I'm sure they're just clicking, yeah, I guess I'm not going to go read this thing, right? So ethics really has not been satisfied by the fact that those things are popping up. It's almost like there needs to be more of a force that actually says, okay, wait a second, you've got to scroll through and just read these 5 points and respond to them. And those are sort of the major things that I want you to know about. On the other side, when we think about ethics and we think about the blockchain, if we were to record all of the decisions that were made about anything, let's take a government position or a company, and we record all the decisions on a public blockchain, that means that now we have transparency. The things that were decided are now clear. And so it actually improves the sort of opportunity for ethics, because if you are exposing the decisions you're making and sharing those results, it makes you now be more careful and think about what's going on. And I'll just add one more piece, which really is where most of the focus has been. It hasn't really been so much within ethics. It's been around data privacy and security. And again, this ties back to law and regulation, but a key element is figuring out, how do we build systems that allow the data itself to be secure and not hacked into and not given away, in some easy way for people to take advantage of it. There's probably a lot more to unpack in that space, but I think I'll stop there for the moment.
Yeah, I think totally that, that's a topic that we could actually drill into, which I think will be interesting. But I think that sort of idea that the blockchain, the technology around blockchain offers that transparency, because what we do at the moment is, just click yes and we don't read the fine print. And I think having that blockchain technology, at least as an initial part of it, is making that transparency in terms of what's happening with the data and where it's going. So I think that's going to be quite interesting. Sheila, I can imagine in the healthcare industry, there's some challenges and some concerns about integrating Web3 technologies as well.
I think Web3 is still very, very, very in its infancy in terms of being able to integrate into healthcare. I've not really seen a lot of use cases yet, but I do think that the opportunity there is huge. When we think about data, a lot of healthcare centers on being able to access patients, labs and CT scans and other information which teams are using to make decisions. You often have multiple specialists that are accessing that information or requiring information. So there's a lot of data that exists that doesn't always work together and integrate and communicate together. So I think Web3 could potentially help solve for that. Like we hear a lot about this idea of interoperability of data and being able to move data between platforms and getting data in front of the right people at the right time. I definitely think that if we can leverage Web3 to do that, that would be ideal. And as you know, we've all interacted with doctors. The time you get to spend in front of a clinician is very limited. And they often can't sit and talk to you for an hour or two about what's going on with you. So I think there's definitely an opportunity for Web3 technology to provide guided interactions or supportive interactions that can fill the gaps or help clinicians focus on a high quality interaction with the patient without having to be focused on the documentation. Some of the low level decision making might be able to be managed, within some sort of technology so that the provider can really have that like trust building, education, supportive interaction with patients that really improve the quality of care overall. And I think a lot of healthcare is really moving towards this idea of whole person care, like not just dealing with the specific like disease or the mole on your left toe, but looking at the person as a complete person. But I think part of the reason why that's hard to do is one, the fractured information, but also like there's not a nice way that the tools we have now present the patient to the provider. What we often will see in settings that get this right, there's usually an extender like a nurse practitioner or a physician assistant, or even residents are utilizing that capacity to kind of present the patient to the provider so that they can go then into the room and have this high quality interaction. But maybe there's this maybe we can leverage a concept of like a digital twin that can kind of present the patient to the provider with their history and their appointment history and their preferences. Like, for example, the patient prefers that the doctor sit on their left side versus their right, like all the things that makes for high quality interaction. And the last thing I'll say is probably one of the biggest challenges we have. I think this is definitely global, but also in the US in particular, is this idea of unequal access and differences in the quality of care that people are seeing. So health equity, which is the space that I'm in, is really big right now as we're really trying to grapple with the legacy of racism and racist policies like redlining that have really made it so that communities of color don't have access to the resources and tools that would allow them to have those engagements with the healthcare system that would lead to better health outcomes. However, we know that most people these days have access to a phone or even a smartphone. So that technology is sitting in people's pockets, can be leveraged. I think in Web3 can help us to do that, to close that gap and allow people to engage in healthcare at the time and place of their choosing with much more agency and ownership of over what the interaction looks like and what is prioritized in terms of their healthcare.
I love that piece that you just said about how Web3 technology and the fact that everyone has, potential access to a smartphone can help bridge some of that equity gap. That's really quite interesting as well as a topic. And what I also heard from you, Sheila, was that, yes, there are some challenges, well, probably, a fair amount, but once the healthcare industry sort of leaps into that next sort of stage in some addressing some of these challenges, there's a huge amount of benefit, especially from patient care, in allowing that sort of wide view around the patient. I love that, sort of going in and the doctor knowing all these things about me already and looking at it from more of a holistic perspective. So it could really increase patient satisfaction and therefore people's health, which I really love. And Bruce, if we look at this sort of the benefits from an industry perspective when it comes to Web3, what are some of those, we talked earlier about some of the challenges and ethical challenges, but what are some of the benefits from a broader industry perspective as well?
So I think this general concept of the blockchain itself and it being a space where you're creating permanent records now, and I think that there is an interesting piece here is because there is public blockchains and there are private blockchains, right? And so, in the healthcare and in places in finance, there's probably going to be a lot of places where you still want to be able to use the blockchain because it creates that permanent record and it creates that history. We've been talking a lot on a completely different space around, how authenticating goods themselves and seeing the history of how they were sold. So if you take some sort of high-end fashion item, right, and that actually is something that you bought and then it was recorded on the blockchain and you actually have something that goes along with it that actually identifies that item. And then you say, well, I want to go resell it. Well, today, most of the time you go to resell things, there's no way to verify, what you actually have in that space. So now there's this opportunity to create this record of, okay, here's all of the ownership of this individual item. We talk about doing that in automotive. There's like a whole place where automotive titling, and I believe California is actually working on this right now, where you're basically saying, hey, all of the history of a vehicle is now going to be on the blockchain because that really can be public information. Who was the owner? They could even be the service records that go along with it. So when, as a company or an individual that's now going to buy a vehicle, you should be able to see all of those records that have now become permanent around that vehicle. So it's kind of competing with those existing companies that, you pay a fee for, but now this can become public information. The complexity of how things get secured on the blockchain does allow this kind of new kind of security. And it's not really new because it has been out there, but it's really just, there's many more ways to do it. there's faster ways there, and there's also this opportunity to do more direct transactions. So today everything kind of goes through a middleman, and of course marketplaces really still are, a middle person, in that space, but you can do peer-to-peer transactions, which is really what the blockchain, a lot of the stuff that was designed in Ethereum was originally designed for. Say, hey, I want to send something to you, Heena, directly. I want to create this exchange, person to person. And so that's, another thing that can go on. And we've already talked about this, but this control over your personal data, I think, is another, key element. And the fact that, businesses can now really say, hey, I'm going to be, ethical with you, and I'm actually going to give you control over, how you participate with me. And I think that, especially as sort of the world has been changing and new generations are coming in, there's an expectation that's way different than the older generations, that I'm going to understand what's happening with my stuff, and I want ownership of it, and I want to see what's happening. I'll kind of end this same thought with the fact that you really can design this from anywhere in the world and be working it from anywhere in the world. So that's another opportunity. There's so many new people that can come into the space. We've always said there's not enough technologists that can actually keep up. Even with the amount of ChatGPT and the others, there's really not enough people working in the space to keep up with it. And now talent really can be sourced from anywhere.
I love that, Bruce. I love how you just put all these benefits together, summed it up for us. And yeah, especially the the last part, that everyone could work on the same thing, the same project at the same time. If I want to touch on circle of trust, our Evenness project as well, our team, our own team, we are working on something big together with each other, and everyone is from a part of the world. So that is very fascinating for me personally when I think about it. And so just to conclude the benefits of Web3 and how we can just improve this space, Sheila, I just want to ask you that what are some practical consideration in terms of healthcare that you can touch upon and give us some examples as well?
Absolutely. And I talked about a few of them earlier, but there's some that I think are also worth considering. I mean, as you all know, a lot of healthcare in managing one's health is education, right? It's learning how to eat well, or, how do you prepare for that surgery? How do you care for yourself once you leave the hospital? It is quite a bit of information that patients have to retain. And I think, there's an opportunity for Web3 tools to create adaptive learning tools that is continuous and monitors patients and adapts to their needs, their living situation, their language, their culture, to deliver the education in a way that is very intentional and feels safe and accessible to them. So I think that is definitely an opportunity. And another one is everyone has used Dr. Google at some point or another when you had a weird rash or a funny cough. And I've heard headlines that, ChatGPT passed the medical exam and has even diagnosed conditions. This is really making the science of medicine much more accessible to the average person. And as much as I think that might be scary for some, I do think there's an opportunity to create a more balance in the sometimes asymmetric power dynamic that can exist between clinicians and their patients, because then patients can come in to these conversations much more informed, and it becomes a partnership. They can work together to solve their problems or to deal with whatever illness or disease is in front of them. And I think the other area is when it comes to decision making. As much as there is a lot of science in healthcare, some of it is art too. Some of it is just based on years of experience, intuition, gut, instinct. And providers are often in positions where they're having to make split-second decisions that often will decide the course of life trajectory or quality of life or even life and death. And I think if we can harness more data and put that at the fingertips of providers to really level up that decision-making power and provide more odds of success and those kinds of things, and allowing that decision-making to also be tailored based on that patient's experience, their culture, their race, their gender, their past medical experience. That's almost too much information that one individual brain, I think, can process all at once, but creating those tools to enhance decision-making, I think, would make a huge impact in terms of like outcomes and how providers are able to deal with some of those like really major decisions.
And I love the fact that you mentioned partnership as part of that as well, because it's partnership with healthcare providers, the patient and the healthcare providers, rather than us going off and doing our own kind of self-diagnosis. And it's important that, people are bringing both elements together, because I don't know what I'd be self-diagnosing for myself, so it's good. And also I liked that whole, you said quite some interesting things with the adaptive, creative and personalized, and educating ourselves, and sort of that really taking ownership of our health. I think that's what I find quite exciting about sort of the journey, because it's something we will all have a part in as part of that. As we sort of start to round out towards the end of our podcast, Bruce, we've talked a lot about, the benefits in theory and some of the considerations people need to make around Web3. But what are some of the practical steps that businesses can take to sort of really start thinking about Web3 technologies as part of their operations, or even start dipping their toe?
So that's it's a really good space to think about. And so, especially for existing businesses that are not becoming startups in this space, because that is another whole path we can address, is think about, what are the use cases that actually work for your business that you could enhance? Are there things that you want to give more control or allow have the opportunity for people to kind of operate within your environment? I mean, I was working in a space where the primary business was really a lot around financial education. And most of it was sort of, drawn in like constant articles, being put out, and really sort of more as a marketing engine to get people to come in and buy the service. But another way to think about really helping your in essence, your members, right, of that service, is really allowing them to have this opportunity to, get educated within the space. So, the whole idea could be creating something that now says, okay, people who have been maybe writing articles today now could actually become educators. They could earn as a result of becoming educators in that space, right? And then people who come in could even be rewarded for the fact that they share information about the educators that are in the space. It's a model that's very repeatable about, creating an economy within a new space or within an existing space where I have an existing membership, but I really don't allow the members to really interact and have an opportunity to really kind of go deeper into the system. And of course, once you've got your idea and good business case, you really need to begin to think about, how do I assemble a team, right? Because I've got new technologies, very few people understand them. So it's really going at research. It may be, there's a lot of companies out there now kind of who are trying to do this. So kind of evaluating who they are, bringing stuff together. Of course, you're going to need, expertise in blockchain, smart contracts, and decentralized applications, but you really also need the actual knowledge in the Web2 space, because all of the stuff that's actually being built is mostly still being built on top of that, Web2 infrastructure, and then sort of merging its way into a Web3 space. And, I would say, sort of continuing on that, just going to think about, like I said before, the ethics, the security and privacy, the whole idea of what this new business is, and make sure that you're, stepping your toes in initially. Don't just like jump fully in, because you might just kind of blow up something and hurt your business, but kind of find your way, kind of like identify things, start smaller, and work your way, into something that's going to create a lot of value for the people that you're really trying to address with whatever your product is.
Well, I love that, Bruce. I just want to go back to Sheila for a moment, like on the thing that you were talking about, like the benefits and giving us some practical examples. I just saw this tool a few days ago, GlassAI, that is going to give more help to the doctors. It's not for all people to use right now. Like it's just for the doctors that they can use, get more technical results out of the patients, like examinations. So that would be something, very helpful in the medical industry. Facilitate things in terms of maybe even time, as you mentioned, that many factors that you are dealing with in terms of healthcare. Bruce, I really enjoyed what you were talking about, the education. I think because like Web3 is not totally here yet, it is more Web 2.5-ish space that we are being in right now. And as we had a conversation earlier with Sheila, maybe in some fields it's even more Web 1. I just think that the future of Web 3 could be really exciting.
Yeah, I totally agree with you there, Ned. I think that there's a huge amount of opportunity and excitement. And listening to Bruce and Sheila, we only hit the tip of the iceberg on some of the ideas and opportunities that this can provide for companies going forward. So I think, essentially that whole Web3 technology is going to be quite exciting. Last question for both of you. I'm just going to do one quick question. Is there a top tip that you could, either one of you, like to give the audience in terms of they're starting their journey on Web3?
Wow, one top tip, huh? Oh my goodness, it's funny because I would say be an explorer, but don't go too hard in. A good thing just to learn something initially is go try to get yourself a wallet. Don't have to put any money in or anything, but just get yourself a wallet so you can just get a basic understanding of, okay, here's my address, or here's an address that I actually own, which data can begin to get associated to. So if you don't have a wallet today, it's a good exercise to get some understanding of like what it is to be in Web3 yourself.
Yeah, I love that. Yeah, it's just a really nice practical thing that everybody can sort of get on with. And Sheila, do you have like one of your top tips?
Yes, thinking about kind of my journey, and I thought about, was interested in, curious about Web3 for years before I actually kind of started to get engaged and learn about it. And I have to say, I had to cross this mindset threshold first, because most people, when you're introduced into the concept of Web3, it can be quite scary because it's so big and unknown, and it's the idea of like the Terminator movie, and in the background, like the robots are going to take over and I'm not smart enough to keep up with them. I had to, start with the mindset that, this is not something to be fearful of. And just by learning more about it and creating opportunity and safety for everyone else, like we need everyone from every background and every lived experience to be in this space and participate and shape it. It's the people who are in it that make it what it is ultimately. So I'd say first address your mindset and your own fears or assumptions about the space, and be open to, learning, because it is still very, very much evolving, and it's the people who are in it that are shaping it for the future.
I would just add one more thing behind all of that before, Heena, was that don't forget there's so much information here. You can get in so deep that you just don't leave your computer or your phone. Make sure you take time for yourself, get outside, touch grass, do something that is completely unrelated to this, because it is a vortex that can suck you in super deeply.
And that resonates with me.
Ned, you've been working with, Web3 for quite some time now. What would your top tip be?
Well, I think that Bruce is touching on something very important here, that the FOMO is real when you just start, navigating around. Like most people start from Twitter, then you just get yourself caught up in these never lasting Twitter spaces. It gets so much exciting, but at the same time, like you can just get 3 hours of sleep in 24 hours, which is very unhealthy. I'm for staying healthy, self-care. We are working all together for something better, for the individual sovereignty, for creating a better life for ourselves. That's really important to create that balance.
And so I'm going to answer this question from not a very involved Web3 user and let's go with a tech person. And for me, that top tip is, sort of get involved in like little events where you can be part of the metaverse. So for me, my sort of gateway into some of this stuff was, some of the events Evenness started to create, and just popping in and, trying on my avatar and being and starting part of the conversation, and just kind of, sort of having a little bit of, oh, I wonder what this is about, and just following a little bit of that and keeping it at the level that suits me, to be perfectly honest, as well. And I think we should all do that in whatever way suits us. Well, anyway, we're coming to the end of our podcast. I really would like to thank Sheila and Bruce. You've been amazing guests. I'd love to have you back, because I think we could just talk individually to you on your topic for ages. So thank you very much for joining us.
Well, I would just say, thank you for, having me, enjoying being here. Don't forget that there is an opportunity for fun here. And so, make sure you are enjoying yourself, as you go through this space, at least some of the time. And because I think it's really important. Otherwise, just like Ned said, it is so easy to get to burnout. It could happen in a week. It could happen in a month. It may happen in a year, but it will happen.
Yes. And having burnt out myself, yes, I definitely suggest like finding that balance and finding hobbies that aren't attached to a device, for sure. But thank you so much for having me. This was a joy to be part of this conversation. I love thinking and talking about the possibilities of the future. I love that we're, sharing these ideas with the audience so that, they can be inspired and take it and run with it. So I look forward to more conversations in the future.
Stay tuned for our next podcast. Thank you all for listening.